My dear students, welcome on the new session. We are doing endocrine system, the drugs affecting the endocrine system, and in the sex hormones. On this session, we are doing some androgens and we are doing the drugs affecting the androgens. As you can see on this slide, the important androgens are testosterone, androstenedione, and dehydroepiandrosterone. You can have a look how I have written it. This is not the real way it should be written, but because the spelling is difficult and the name is difficult, I have written it, I have split it up so that you can read it this way and you can remember. Androstenedione and dehydroepiandrosterone. Meanwhile, in testes, in prostate, in seminal vesicles, in epididymis and the skin, testosterone gets converted into dihydrotestosterone. That's called DHT. And this is the form of testosterone which combines with the testosterone receptor. And the enzyme which catalyzes this reaction is called 5-alpha reductase. So testosterone to DHT, dihydrotestosterone, the enzyme is 5-alpha reductase. And remember this particular step, we are going to explore this step while discussing about some drugs. The DHT which is formed in this way, it combines with the testosterone receptor. What's a testosterone receptor or androgen receptor? We are mostly in the substances which have got steroidal structure. So I alarm you about the type of receptor. It's not a cytoplasmic receptor, it's a nuclear receptor. Just like the steroids, the thyroid hormones and the estrogens. So it's a nuclear receptor. The hormone receptor complex undergoes the dimerization. Then there's binding to DNA and there's synthesis of specific RNA and leading to the protein synthesis. The nuclear receptor is present at most of the tissues which are concerned with the male system, plus it's also present in the muscle and liver. And once again a reminder, DHT combines with the testosterone receptor. Androgens are the male sex hormones, and going to their actions, they'll be producing all male sex hormone effects. So as far as the male sex is concerned, the normal male maturation, the behavior, the reproductive system development and the structure and function of the reproductive system, all this will be under the control of androgens. Then at puberty, the development of the secondary sex characteristics. But although we call them sex hormones, they have important anabolic effects which will be parallel to the male sex. So they produce anabolic effects. The anabolic effects on bone, most important. So there's a androgen receptor in the bone. This leads to decreased resorption of the bone. Next, in the muscles, these receptors are going to stimulate, these substances are going to stimulate the muscle proteins. Next, development of the RBCs, red blood cells. You have a testosterone receptor. Next is development of the liver. And lastly, they inhibit the nitrogen excretion. So they will be in favor of the protein synthesis, they will be in favor of development of the muscles, and they will be in favor of development of the bone. Now we are talking about androgens and we came to some anabolic effects. And these anabolic effects are in terms of the positive protein balance, positive nitrogen balance. And this is why I am showing you a table which is called anabolic to androgenic activity ratio. For example, if you pick up a substance, this substance has both the actions, right? One is the androgenic effect, that's the typical male sex effect, plus it may have anabolic effect. It has anabolic effect. What's the ratio of the androgenic effect and anabolic effect? If you put anabolic effect first, and I write it as anabolic is to androgenic. So I've written here ana is to andro. Then usually this ratio is 1. Means 1 is to 1. 1 is anabolic activity and 1 is androgenic activity. So those substances which classically we call androgens, they have a balance of the male sex activities and the anabolic activities, or the androgenic activities and anabolic activities. So when the ratio is 1, you just call it a proper androgen. Examples of these are testosterone, then the esterified long-acting derivatives, that's cypionate and enanthate, and methyl testosterone. So these substances we call classical androgens. Now we go to the next row. If this anabolic ratio starts increasing as compared to the androgenic ratio, it can sometimes go to 2. That's 2 is the anabolic activity and 1 is the androgenic activity. So I call it 2:1, or sometimes even more than this. Then this substance no more remains to be called only androgen. Its predominant effect now has become anabolic effect. So such substances are called anabolic steroids. The question, are they androgens? The answer is yes. But they are androgens with more anabolic activity, and we call them anabolic steroids. Those who have anabolic androgenic ratio more than 2. Examples, fluoxymesterone. The ratio is 2:1. And there are substances which are still more anabolic, means the ratio is still higher. Names of such substances are oxandrolone, nandrolone, and stanozolol. We are going to explore this, the information about the more anabolic activity further. Before that, we go to discuss the uses of androgen. Androgens are male sex hormones, so if there is any deficiency, these are going to be used. So logically, they are useful in male hypogonadism or also in testicular failure. This male hypogonadism may be primary or secondary, and we call this as replacement therapy. So also, if the patient is suffering from hypopituitarism, then these drugs will be useful as adjuncts in the treatment. The next indication is delayed puberty in the males. Of course, androgens will be useful. The next indication is carcinoma breast, and this is the place where the sex hormones start getting interesting. It's a carcinoma breast in a female, and we are trying to use an androgen. And how is it going to act? It's going to act as an anti-estrogen in the estrogen receptor positive tumor. So if it's an estrogen receptor positive carcinoma breast, so it's estrogen predominant carcinoma, you give an androgen and the androgen will start working as anti-estrogen. So carcinoma breast, androgens act as anti-estrogen. And the last condition is resistant anemias. We already spoke, there is an androgen receptor in the red blood cells, and this receptor will be coming into action, and the resistant anemias which are not responding to your nutrients are going to respond. The next use of androgens sometimes could be in endometriosis, and especially if there is ectopic endometrial growth. The drug which is used for this is called Danazol. The next indication or use is fibrocystic disease of breast. Again, Danazol is useful. Danazol is a mild androgen with weak partial agonist activity at progestin receptors. And Danazol is sometimes called as impeded androgen because androgenic activity is weak, and it also has weak partial agonistic activity at the progestin receptor. The next use for androgens is hereditary angioneurotic edema, and you can also use methyl testosterone or stanozolol. I'm reminding you, stanozolol was an anabolic steroid. It's useful in hereditary angioneurotic edema. Let's come to discuss the adverse effects now. These are characteristic male sex hormones. So if they are used in excess in females, it's going to lead to virilization in the female, presence of acne. In the female, the voice will be getting deepened, and there will be signs of masculinization. There will be growth of the facial hair, then the male pattern baldness will develop, and the muscle development will be male-like, and she is going to suffer with some menstrual irregularities. If androgens are used during pregnancy, then it's going to produce virilization of the female fetus. If they are used in children, mind well, they are going to close the epiphysis prematurely. So there's early epiphyseal closure, and the linear growth will be affected, and it can lead to precocious puberty and also gynecomastia. And if androgens are used in males in excess dosing, this can lead to priapism during early therapy. And second very atypical effect happens. Look at this, what happens if you give androgens excess dose in the males. When there is excess androgens circulating in the blood, they are going to produce a feedback inhibition on pituitary. And in addition, these excess androgens get partially converted into estrogens. That's very atypical. They get converted into estrogens. And in this male, you can see the effects of gynecomastia, testicular shrinkage, infertility, impotence, and decreased spermatogenesis. Because all the estrogenic effects have started happening in this male. So this happens if androgens are given in excess dose in the males. Lastly, they produce behavioral effects, they produce aggression, and these drugs can also lead to acne. The adverse effects are more severe as far as the cholesterol is concerned. They lead to increase in the LDL, decrease in the HDL, and they increase the risk of coronary artery disease. This is not enough. They also produce retention of fluid and lead to edema. As far as liver and biliary system is concerned, they produce cholestatic jaundice and transaminitis. That's the elevation of the liver enzyme levels. However, this is found to be seen only with the methyl testosterone and the 17 alkyl derivatives and the anabolic androgens. If you are using the parenteral esters of testosterone, which I told you, then with these substances, cholestatic jaundice and hepatic damage is comparatively less. Long-term methyl testosterone has been associated with occurrence of hepatocellular carcinoma. And the next adverse effect, of course, it's an androgen, is going to be acne and hirsutism. So let's think what will be the situations in which androgens will be contraindicated. It's a male sex hormone, so it will be contraindicated in carcinoma prostate. Second, it will be contraindicated in male breast carcinoma. Number 2, they are absolutely contraindicated in pregnancy and if the patient is suffering from any major liver or kidney disorder. And just now we saw the effects on the cholesterol, the effects on the fluid retention. Obviously, they are contraindicated in patients with heart failure. So also patients with epilepsy and migraine. So after discussing some of the androgens, let's go further once again to the anabolic steroids. We said few things about them. The anabolic to androgenic ratio is more than 1 and it could be between 1 and 3. And if these drugs are taken continuously, it leads to muscle hypertrophy, oily skin, acne, hirsutism, and gynecomastia. There are patients you can come across who are injecting themselves with the anabolic steroids and who are obsessed using these anabolic steroids. So you can see needle punctures on the body. This patient is likely to have edema, likely to have jaundice, and a surprising observation will be this patient will have very high hemoglobin and hematocrit. Increased hemoglobin and hematocrit. So also LDL cholesterol will be high, LFTs, that's the liver function levels, will be high, and the HDL will be low. These are all characteristic effects. You need to do specific test to detect the urine steroid concentration to find out if a particular patient is using anabolic steroids for a long time. Names of the anabolic steroids are methandiadone, nandrolone, oxymethylone, stanozolol, and ethyl estanol. Let's revise them once again. The names are difficult. Methandiadone, nandrolone, oxymethylone, stanozolol, and ethyl estanol. Are the anabolic steroids useful? Yes, they are useful in certain situations. Look at the condition, senile osteoporosis. It's a very severe senile osteoporosis. You don't have any other option. You're already exhausted with all the drugs. You can think of using anabolic steroids. Next, if the patient suffers from chronic wasting syndromes, like chronic immunodeficiency state, that's an HIV disease or a cancer, and the patient suffers from chronic severe wasting, you can think of giving a boost by using anabolic steroid. They are useful as adjuncts in the management of burns, and they're also useful to speed the recovery from surgery. Of course, this is not for routine use. In exceptional cases, when you feel for the recovery something is needed, anabolic steroid can be used. Just as that, chronic debilitating illnesses, chronic debilitating diseases, you can give anabolic steroids for their anabolic effects. Some other uses I'm mentioning down is not the approved uses. Number one is illicit use by the athletes to get the metabolic effects. We call it illicit use. And there are some other people who have the obsession, who want to increase their lean body mass, so they use it. So I'm not saying it's illicit use, but I'm saying unapproved use. Unapproved use for a short period of time. This might be practiced by some patients. Illicit use by athletes for metabolic effects is a more dangerous phenomenon, and it could be a chronic use. Whereas in the other patients, they might use it for short periods of time in restricted doses. That's the unapproved use to increase the lean body mass, muscle strength, and stamina or the endurance. So these patients could be athletes, they could be bodybuilders, or it could be some other patient. Anabolic steroids, if they are used in excess by the athletes especially, it leads to decreased testicular size. There is premature epiphyseal closure and stunting of growth, especially the person of growing age takes the anabolic steroids in excess dose. Mind well, there can be severe hepatic dysfunction, there can be liver dysfunction, and it leads to aggression and leads to mood disturbances. So this is something adverse as far as the athletes are concerned with regard to the anabolic steroids. So we discussed androgens, we discussed the anabolic steroids, we said what's the ratio, that's the anabolic to androgenic ratio, and now we go on to discuss some of the drugs which act on the androgens or which affect the androgens or may be acting on the androgen receptors. So we call them antiandrogens, and antiandrogens is effect of inhibiting the androgenic activity can be brought about by various mechanisms. The first mechanism is blocking the androgen receptor. So these are androgen receptor antagonists, or they are blockers of the androgen receptor. Look at the examples: flutamide, nilutamide, and bicalutamide. These are very useful drugs. They are androgen receptor antagonists, and if they are androgen receptor antagonists, they will be useful in the management of carcinoma in the male prostate. So please remember, antiandrogens, they are antiandrogens. Obviously they are useful in the management of carcinoma prostate. There is one more androgen receptor blocker, that's called cyproteron, and this is used in the males to treat precocious puberty, and it can also be used in the females for management of acne and hirsutism. There are two more drugs which I have mentioned in this slide. One is spironolactone. Any guess? What is this substance? Are you remembering any pharmacology? Spironolactone, a very important drug which is a potassium sparing diuretic and which is an aldosterone antagonist, extremely useful in the management of heart failure. This drug does have androgen receptor blocking property and is used in the management of hirsutism. This will help you to remember when you do your spironolactone chapter that spironolactone has the adverse effects on sexual system. The second drug I have written down is cimetidine. This is an older H2 blocker. It's not used now, but it could be used in the management of female hirsutism. I have just included this drug to give you the idea about the mechanism, how cimetidine produces sexual dysfunction, that's by the androgen receptor blocking effect. So it's of academic interest, and for you it's also important for your examination. Next way of antiandrogenic activity is by inhibiting the 5-alpha reductase enzyme. So I'm coming to the point with which I started. I hope you remember. We said testosterone gets converted into dihydrotestosterone, and the enzyme doing this is 5-alpha reductase. So I've shown you the step once again, testosterone to dihydrotestosterone 5-alpha reductase. And dihydrotestosterone is known to produce hair loss and is known to produce prostate enlargement. Now what's important for us is inhibiting this 5-alpha reductase enzyme. Look at the sign of inhibition. We have drugs which are 5-alpha reductase inhibitors. They are going to inhibit the 5-alpha reductase, so they will not allow the active form of testosterone, that's dihydrotestosterone, to be formed, which is going to act on the various androgen receptors. Name of the drug is finasteride, and one more substance is dutasteride. And finasteride is useful in benign prostatic hyperplasia. It's useful in benign prostatic hyperplasia, because as you see here on this slide, dihydrotestosterone is responsible for prostate enlargement. Please don't make an error. Finasteride is not useful for carcinoma prostate. It's just useful for benign prostatic hyperplasia, because more levels of dihydrotestosterone are responsible for enlargement of the prostate. So also you can use finasteride to treat the male pattern baldness. So these are some anti-androgens. Number 1, blocking the androgen receptors, and number 2, inhibiting the 5-alpha reductase enzyme. Now you have the third one. What is this doing? This is neither blocking the receptor, nor it's going to the 5-alpha reductase enzyme. It's a gonadotropin releasing hormone analog, and it acts on the center, and it inhibits the release of luteinizing hormone, that's the LH. So it inhibits the endogenous release of the LH. This leads to decrease in the testosterone. So it is as good as decreasing the testosterone levels inside the body, but the mechanism of action is central, is going to act in the center and is going to bring down the LH release. This is going to bring down the testosterone secretion. Name of the drug is leuprolide, and it's a long-acting substance. So leuprolide is useful in the androgen receptor positive carcinoma prostate. It's useful in the androgen receptor positive carcinoma prostate. There are some other drugs which are also anti-androgens, and just now we mentioned one drug. Now we again go to mention it. Inhibitors of the gonadal and adrenal hormone synthesis is your ketoconazole, which is an azole antifungal, and again spironolactone. Are they used anywhere? Yes. They can be used to suppress the steroid synthesis, especially in steroid responsive metastatic tumors, gonadal tumors, or also as adjuncts in the management of Cushing's syndrome. So that's the use for ketoconazole and spironolactone. And lastly, once again I mentioned cimetidine, which has got an anti-androgenic effect. At the end of the discussion of anti-androgen, we discuss an atypical substance. I just made a mention to it, and the name of this substance is Danazol. It is an impeded androgen. It is ethisterone derivative which is orally active, and its androgenic property is weak. That's why we call it impeded androgen. But it's got anabolic actions, and it's got progestational activities. It goes to the androgen receptor, binds to the androgen receptor, and stimulates the protein synthesis, and this leads to decrease in the gonadotropin secretion from the pituitary. This suppresses the testicular and ovarian function. So it's used in females. It produces in females the endometrial atrophy and amenorrhea. Have a look at it again. It goes to the androgen receptor, stimulates protein synthesis, that leads to decreased gonadotropin secretion from the pituitary. So there is suppression of the testicular and ovarian function. So in females it leads to endometrial atrophy and amenorrhea. Uses, obviously we use it for managing endometriosis and menorrhagia and fibrocystic breast disease, that's chronic cystic mastitis. It's also useful to treat hereditary angioneurotic edema. These are important uses of Danazol. Danazol is going to lead to amenorrhea and endometrial atrophy in the females as adverse effects. It's going to precipitate acne, hirsutism, I hope you understand its androgenic effects, decreased breast size and deepening of voice. Plus, being a steroidal structure is going to produce sodium and water retention, edema, weight gain and also hot flashes. It's going to lead to loss of libido in the men and muscle cramp, night sweats, GI disturbances and elevation of the liver enzymes, and this is some important adverse effect. We need to keep a watch on liver function. So I hope we went through and we touched all the different aspects of the androgens and the other drugs related to androgen, and this module is going to be helpful to you, and I am sure you'll succeed in the task which you have undertaken, and I hope I'll be helpful in your task to achieve the task. Please go through all the modules, put your own efforts, build up your own concept and succeed.